Adjusting BruxZir restorations is definitely different than anything we've done in dentistry before. Most of the time in the past, we've either been adjusting porcelain on a PFM restoration, or we've been adjusting the porcelain on an all-ceramic restoration. BruxZir is different, of course, because it's a solid zirconia restoration that has no porcelain on it. So we're going to need different burrs and different polishing wheels to be able to adjust and polish it effectively, and we'll take a look at those later. Also, there's going to come a time where you're going to have to cut off a BruxZir crown or a zirconia-based restoration. And if you don't have the correct burr in your office, it's going to be very, very difficult. What you're going to find is you'll be able to cut through the porcelain on the outside of the restoration, and when you get to the zirconia-based coping, whatever burr you're trying to use is just going to spin on the coping and polish it and heat it up and not cut through it at all. The good news is that the same burrs that you're going to find in the BruxZir adjustment and polishing kit are the same burrs that you use to cut through zirconia. So if you have this BruxZir kit, you're going to have the burrs that you need when eventually you have to cut one of these crowns off. Another question I get from dentists a lot is, what's the wear rate on opposing teeth from BruxZir crowns? And that's a great question. We're in the middle of a study right now at a major U.S. university, and we're about 100,000 cycles through it on a chewing simulator. And so far, after those 100,000 cycles, I'm happy to say that the wear rate on the opposing teeth from the BruxZir crowns is roughly the same as that of lithium disilicate, or EMAX crowns, and so we're cautiously optimistic about this. I think you're going to see as we polish some BruxZir restorations that you're going to understand why it probably doesn't have a large wear rate on opposing teeth. And that's because when it comes to wearing opposing teeth, it's got more to do with how rough the surface is rather than how hard the surface is. And one of the things that's been a little counterintuitive that I've learned from BruxZir is that zirconia material is actually easier to polish than feldspathic porcelain. Let's take a closer look at what we need to do to adjust and polish BruxZir restorations. So here is the BruxZir adjusting and polishing kit. Let me take it out of the box here. First thing you'll see is it comes with a little set of directions, and for reorder it shows you all the different tips that are in here. I tried to keep it as simple as possible. I apologize for having my face there. And then it just shows you some common usages of the different shapes, and you'll see that as well. It's also got the prep kit, the reverse prep kit. If you've seen the way that I like to prep crown and bridge, we've got that DVD available on our website where it explains why I like to use that prep technique to get consistent reduction and consistent aesthetic results. Here's the kit itself, and you'll notice I've done my best to keep it simple as possible. There's just a couple of different shapes on here. We've got 3 different shapes of diamonds, and we've got 3 different polishers. So the first thing to notice is the diamond itself. It's a blue striped diamond. You know, you'll see other grits of diamond that have different color stripes on them. For example, turbo or super coarse diamonds have black. The green diamonds are the medium grit. The red diamonds are a superfine grit. You'll see the white grit as well. And this is a blue stripe, and it's a different grit. It's a proprietary grit. I can't even tell you what the grit is. Axis actually won't tell anybody what it is because it's a diamond that only they make, and it's particularly good for cutting through zirconia. You know, the first couple times I tried to cut through zirconia, I went for a very coarse burr. I went for a burr that had huge diamond particles like I'd use to prep a tooth, and it did nothing to it. So it was very counterintuitive that you would need a burr that had much more of a fine grit as this one does to be able to go in and cut through this zirconia. So you're not looking for something that's really coarse. You're looking for something that is more fine, like these blue striped diamonds. As with most ceramic polishing system, there's actually a 3 grit system on the BruxZir adjustment and polishing kit. There's the green pre-polishing cup, the blue polishing cup, and the yellow high shine cup, and they're used in that order. So it's hard to tell just by looking at it, but there are 3 different grits of the diamond particles that are embedded in these silicone cups. There was also a choice of doing points instead of the cups, but I'm a cup guy, and I'm a cup guy because these cups last so long. And they'll get almost anywhere. You can get the occlusal surface, you can get the lingual, you can get any kind of axial surface or interproximally. And I hate when silicone points come in a kit and by the time you used it 2 or 3 times they've just disintegrated, you know, down to the shank. And so I really like these cup shapes because they last a long time. And I hate getting a kit and then having it disintegrate in front of my eyes after I used it 2 or 3 times. So we've just got 3 diamonds and then 3 grits to polish it with. So let's go ahead and take a closer look at what this looks like on some BruxZir crowns. I would probably be remiss if I didn't mention my affinity for this handpiece. I love electric handpieces. I get that they're bigger and they're a little heavier, and some dentists may have musculoskeletal problems that don't allow them to hold a heavy handpiece like this throughout the day. But the torque on this Cavo electric torque is unbelievable. And the 2 things that I really love about electric handpieces are the ability to turn the speed down and run it without water and still have an incredible amount of torque for when it comes to finishing a crown. And beyond that, when it comes to polishing restorations in the mouth, because of the fact that we have so much torque in this handpiece, I finally feel like I can effectively polish restorations in the mouth as opposed to an air-driven handpiece where there just wasn't enough torque to keep the polishing tip spinning all the time. So, you know, we hate to have to make adjustments in the mouth, but oftentimes we will cement a restoration. The bite is a little bit high. We need to make a small adjustment. I love an electric handpiece for being able to polish that afterwards and get it back to a high shine. That's what we do in the laboratory. We don't typically reglaze restorations and run them back up in the oven again. We use electric lab handpieces with polishing cups in there to be able to put that high shine back on it before we send it back to you. So here is a BruxZir crown, and I'm doing this out of the mouth just because there's no way we could get this close or get this angle on this in the mouth if we had a molar in the mouth. Maybe with an anterior tooth we could, but as I mentioned before, as of today, BruxZir is not a big anterior restoration. In fact, we don't really make any of them. It's just for the posterior because of its strength. It certainly doesn't look as good as your typical all ceramic crown. But this is a decent looking crown anyway. You can see I've got the football burr. This is that blue grit burr that's in there. And so I'm going to go in and lay into this tooth. You'll notice even with this correct fine grit diamond, you'll see some sparking as we go in and touch the zirconia. A lot of that has to do with the fact that the water's not on. One solution to the sparking is to keep the water on. Obviously, if I had the water on here, I'd be making an incredible mess. Another one in the case of an electric handpiece like I'm using is to turn down the RPM. So I've got the RPMs turned down to about 10,000 RPMs there. You'll notice when I lean into the crown, I'm cutting into it and I'm not even slowing down the burr at all. So you can see the scratch marks that I've made on that BruxZir crown, basically wiping out that cusp for the sake of showing you how this kit works. We'll start the polishing sequence with the first wheel, with the green wheel. We call this a pre-polish wheel. It's before the polish, and mainly what we want to use this for is to get rid of most of the scratches that are there. The fine scratches we'll get rid of with the next wheel, but we just want to do any minor recontouring here at the same time that we may want to do. Out of the 3 cups, this is the one that will remove, a little bit of zirconia material. You'll see that it actually does get better looking as we go through the 3, but it looks much better after the first polish wheel than typical porcelain does. And that's one of the reasons why I think we're going to see that the wear rate on opposing teeth for zirconia crowns like the BruxZir crown is pretty good because it's so easy to make it nice and smooth compared to feldspathic porcelain. So let's move on to the next cup. So now that we're finished with the pre-polished cup, this is the blue polished cup. So we'll go ahead and use this on our BruxZir restoration. So that is the adjusted area on our BruxZir crown after the polish wheel. And you can see just, really almost a mirror-like surface there. Maybe just the slightest hint of scratches there, maybe not. And that's what I mean. Again, that looks far ahead of where a typical feldspathic porcelain PFM would look at this point after 2 wheels. So we'll go ahead and use the yellow high shine wheel here. This is the finest grit of the 3. But you can see that's pretty easy to polish. In fact, I consider this easier to polish now than typical porcelain. And so when I put BruxZir restorations in and I have to make an adjustment, because I've got the BruxZir adjustment and polishing kit with the fine grit diamonds and the 3 grits of these wheels, especially with my electric handpiece, there's no doubt in my mind that I'm going to get a nice, smooth finish back on these crowns, and the patient's going to be able to chew on this for years to come without any excessive wear on the opposing tooth.